Okay, so Marissa, we're talking about tools and things that you would use in the home, and you brought one simple thing. Can you tell us about what you have here on the floor and how you would use this in someone's home?
Well, this is your standard balance device. It's a piece of foam, but you can be creative in the home. That's the nice thing about home health. You use what you have. So if they've got an old throw pillow, dog's toy that they don't mind having on the ground, it's a great way to either assess someone's balance or to work on their balance. Sure. A lot of the folks that we see, they've come home because they've fallen on the ice, broke a hip, or they're getting older and their balance isn't that hot and they're less apt to get up and move because they're afraid of falling. Once that fear is there, then it opens the door to a whole host of other issues. So if we could show them and kind of point out where the weaknesses lie and that we could fix it, it kind of helps build up their confidence, builds up their activity levels, and they're more engaged in their community.
Yes, wonderful. So this is an assessment tool then at the beginning of your care.
Yep. It's kind of advanced. A lot of times we'll just start on solid ground, but if we've got our older farmers that insist on being out and mowing their fields, it's not a level surface yet. You know, not many paved roads up here in Franklin County, so get them prepared for what's normal for them. So if you want to hop on up here. So there's 3 big systems in the body that help you keep your balance. Your sense of touch, your eyesight, and then your inner ear. So on here, your body's picking up that you're not on solid ground, so you can feel yourself kind of swaying back and forth. If I was in the home with someone, you know, probably have a gait belt on them or a tight hold, or have them in front of their wheelchair, somewhere where they feel comfortable. You got to have that trust. If I'm just walking in and say, here, stand on your head, and it doesn't go over that well. So kind of, a lot of folks, this is new to them. So whatever we could do to make them feel at ease, and then that helps with getting them better. So if your feet are wider, of course it's easier. If that looks safe, then I'll ask him to move those feet together. And then each of these holds, depending on the person's age, activity level, if they've got respiratory issues, you know, they can't be up here all day. So we kind of pick our battles. But if you can do this with not too much difficulty, I'll ask you to cross your arms. The more narrow your base is, the more your balance is challenged. If you weren't swaying at all, I'd be really nervous. Right?
Thank you.
A little bit of sway, your body's picking up signals to know where it is in space. Now, this is as far as I get with a lot of folks, but if they want to make that next jump, I'll hover real close, and I have them close their eyes. So once you take that eyesight out of there, your body's trying to figure out any way it can where it is. So if people are getting up, you know, numerous times during the night, not turning their light on to go to the bathroom, you know, that visual input isn't there. So these are basic things that we can kind of see where they sway. We do get some younger folks may have had a joint replacement, random accident, where, you know, they really want to kick it up a notch. So we can go through that same progression, but if we get past that, keep your hands down for a second. Try picking up one foot. So if they're not quite ready to get to outpatient, they have all the bells and whistles there. If it's the middle of winter, they don't have a ride, we can use what they have in their home. So for older folks and our younger population, we can both make it work.
Excellent. So that's a wonderful place. I mean, I can feel myself, and you can watch somebody's cues, and like you said, you're keeping them safe. So if somebody is having more difficulty than I was right now, you're there to make sure they're safe, but it's giving you a lot of information at the beginning of care, and that helps derive what kind of care you're going to continue on through.
Exactly.
Great. Well, thank you for sharing this simple device that, like I said, shows a lot of information for you. I know you use a lot of tools that are similar to this that give you assessment and then also help you with your patients. So thank you for sharing.
Absolutely.
Hello, welcome to Franklin County Home Health Agency's Where the Heart Is. I'm Jennifer DeSablo, your host for today's show. Franklin County Home Health Agency is a nonprofit home health care organization serving people of all ages throughout Franklin County since 1969. Through this monthly show, we bring you information about the agency's programs and services, as well as helpful tips to help you stay safe and healthy at home. This September, we celebrated National Rehabilitation Awareness Week, and I'm happy today to have somebody with me from Franklin County Home Health Agency's rehab team. Marissa Hurley is a physical therapist at Franklin County Home Health. Thank you for being here today.
Oh, absolutely, Jen. Nice to be here.
And you've been here almost a year now, so you're one of the newer members of our team.
Yes, we have a lot of newer members to the team. It's been a new beginning up at in the rehab group. We have a lot of fresh faces, a lot of young talent, eager to get out there and help.
Yeah, a lot of skills and expertise there. We're very lucky to have you.
Yes, we do have some veterans, so we got a nice cross section of people that know the area, and all of us rookies that are coming in, and you know, it's a group effort.
Sure, good. It's always good to have that. So tell us a little bit, before we talk about what physical therapy is, again, about yourself, where you're from, what made you choose this field, and what made you choose Franklin County Home Health?
Well, I grew up in Buffalo, New York, and after doing my physical therapy training there, the hubby and I, we packed up shop and moved out here. We've got family out here. We've always loved vacationing here. It's a great, you know, neck of the woods. So it just became our second home, and now it's our first home.
Wonderful, good. And like you said, learning to travel all those roads. Do you yourself go throughout the whole county, or just part of it?
We try to, for efficiency's sake, stick to a couple of key areas, but without my GPS, I'd be pretty lost still.
Yeah, we have a lot of places to cover. So thank you again for choosing Franklin County Home Health. Let's talk about what physical therapy is for folks who maybe don't understand what physical therapy is in the medical field, and then talk about how physical therapy is different in the home health care setting.
Well, for one, if you would have asked me a year ago what physical therapy was, I'd give you a completely different definition than I would now. I used to work in a hospital, so it was pretty cut and dry. Physical therapists help you get back on your feet. You've got impaired mobility due to an illness, surgery, accident, what have you, and we help you get back to where you need to be. A lot of muscular re-education, we do a lot of neurological disorders, so kind of mechanics, but for the body as opposed to your vehicle. Once you start with home health, you run into, you know, the real world. You know, it's one thing in the hospital to get you out of bed, maybe get you on the bike, but now that you're in your, you know, you're on their turf, and you deal with medication issues, social issues, so it's a mixed bag. So without the rest of the group, we'd be kind of lost.
Yeah, for sure. We'll talk, I just want to jump sort of to that since you're talking about the group. You do physical therapy, and like you said, it encompasses so much about the patient's care. So talk to me about what that looks like at Franklin County Home Health. Who else is part of that team with physical therapists and other disciplines?
Well, our rehab team is comprised of us, physical therapy, occupational therapy, which people have even less of an understanding about. They're like, but I'm retired, I don't need occupational therapy. But those are more the activities of daily living. Can you dress yourself? Can you safely get in and out of the shower? So we kind of go hand in hand. So do they have the endurance to do those activities? So we kind of work as a group. And then we have a lot of folks that either may have had a stroke or have dementia, a lot of neuro issues, and that's when speech comes into play. So our speech pathologists, us, the big three here, we kind of, you know, we have to collaborate a lot if we're going to give you the best outcomes, and not to forget our nurses. So if I go see someone for the first time and they've got a medication list a mile long, I'm going over to the nurses, please, 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 what is all of this?
Exactly.
So it's definitely, it takes a village.
Can you talk about medications and what your role is in watching medications and understanding that?
Well, if there's many complex ones, I'm not usually the only one involved. The nurses, that's their area of expertise, but there's basic ones that we all have an understanding of, and the side effects. So if you're on a bunch of medications that might cause you to have a drop in blood pressure, causing dizziness, shortness of breath, those are things that we need to look out for, because those are red flags. The main thing is whoever's involved in your care, we want to have you stay safe and stay home. We don't want you ending up back in the hospital, because nobody wants that.
Exactly. So also talk about your patients. What are their ages and who you serve as a whole. Talk about the patients, and since you are in their home, there's often other people involved.
Definitely. Well, the agency itself, I mean, we see newborns to the, you know, aged, but the adult rehab team, we primarily see older adults. We do see some younger folks, but our average case that we get is an older adult that may have had a slip and fall, got weak, had surgery, but we do see some young folks, but 9 times out of 10, it's an older adult that's, you know, been a pillar of the community and been in the same house for 60 years. And that's where we run into other issues. These older Franklin County farmhouses weren't built in mind to make adjustments and changes, and, you know, I need grab bars in my shower, but I only have a clawfoot bathtub. You know, things like that, where it's a struggle because they love their home and they don't want to, and they want to stay there, but we have to figure out a way to keep them safe there.
Yeah. Safety is number one.
Yes.
You know, we're coming into fall now, and falls are a problem all throughout the year, but I'm thinking of icy walkways and things, so fall prevention comes to top of mind. Can you talk about fall prevention and your role as a physical therapist there?
Well, a lot of folks that we see ended in the hospital because they fell. And now that they got back, we don't want lightning to strike twice. So what we do in our first assessment, other than, you know, going through your regular PT type thing, is home safety. Do you have railings on your stairs? If you have a ramp, is it at a slope that's gradual enough for you to get up it safely? Do you use salt in the winter? In the bathtub, do you have to sit on a seat or do you have to stand? You know, things like that. So we can make recommendations for equipment. If there's caregivers around, family that would like to help but just don't know how. We do a lot of education and training. For folks that do live alone and family works, you know, we do have options to have helpers come in the home, care attendants, that if they have trouble with showering, have trouble with their light housework, you know, we could get programs in place so, you know, they're not so nervous about being by themselves.
Yeah, and like you said, so you may be a referral source for within Franklin County Home Health, other disciplines such as you mentioned, the long-term care program, or someone to be there intermittently to help them through this care. Who else, so outside of Franklin County Home Health Agency, might you collaborate with in our community?
Well, a lot of folks that we see, if they're older, they're on a fixed income. So I could make all these recommendations, get this fancy tub bench, get these grab bars, but if they don't have the funds for it, they'll do without. A nice resource that we do have are our lending closets, VFW, American Legion posts, where they take a collection of equipment in the community that aren't needed anymore. We'll give them a call, and if they have something that we could use, then our clients can use it until, you know, if they get better and they don't need it, they just ask that they return it. So it's a really nice resource.
Thank you for mentioning that again. I think some viewers will remember Home Health used to do that, but it's been years now that we refer them out to the community, like you mentioned, the Legions and other loan closets. So we appreciate their help.
Oh yeah, they've been really great.
Yeah, wonderful. So you're talking about when you first see somebody coming from the home, what can you expect from, you talked about your patients in the hospital have certain types of care, then they go home, like you said, to the real setting. So talk about that transition to home. What can they expect as that's happening?
Well, it depends on how long they've been in there. If it's just a quick visit, I've got pneumonia, and then it might be just, I'm not where I want to be, how do I get back on my feet? But if it's a big change in their life, it's just, you know, if they were living alone but now it's no longer safe to do so, then we really have to look deeper into the big picture, long-term planning, things like that. A lot of the folks that they come home, if they've had a scheduled surgery though, it's easier to coordinate that because there's a lot of preoperative classes that the folks will go to with our orthopedic surgeons in the area, so they kind of know the protocol and the program. There's pre-scheduled follow-up appointments with the doctor, so they know,
timeline.
Yeah. And then when people are coming home from the hospital, our social workers get involved. They're coordinating with the discharge planners from whatever facility they're coming home from. And then our #1 intake lady, Becky, she gets it done for us. So she gets the information for us so we can get out there and help them once you get home.
Wonderful. Let's take a quick look. We taped earlier you showing a piece of equipment that you use to do this assessment, maybe at the beginning of care when someone comes home. So we'll take a quick look at that.
All right, perfect.
So thank you for showing the equipment that you use for doing assessments in a patient's home. Some simple things, but it gives you a lot of information. Let's talk, you did mention Becky, our intake coordinator. Just want to make it clear to folks how people can be referred to physical therapy with Franklin County Home Health. What is that process?
Well, there's all roads lead to Rome. How about that?
Yeah.
You can be in the hospital, and as you're coming home and they're trying to figure out what you need, you can get a referral from the doctor there or a nursing home. But also, you can just go see your primary care physician if you've noticed that you've had a decline, or if you notice a loved one's had a decline, and they're not quite sure what they need, but you know they need something. As long as you have a face-to-face with your doctor within 30 days, we can get that referral in and see if we can help you.
Okay, excellent. And of course, referrals also come from patients who are already within our system as well. Can you talk about what's your favorite part of working at Franklin County Home Health?
Well, coming from like an inpatient rehab background where I'm in an office all day. It's so liberating to be out in the community, getting in the car, like the leaves are changing. This is like the best time of year to be out on the road. And I like the transition to seeing, what happens after they do leave the hospital. This is their lives. How do we make the most of it? So I love being a guest in someone's home and showing them ways to make the most of their time there.
Excellent. That's a very good job to have.
Yes.
You see those great results and making a real difference for people. Is there anything else you'd like to share with us about physical therapy that maybe folks aren't aware of, or things about Franklin County Home Health that you'd like to share about your work?
Well, we're not just exercise. We kind of touched on the home safety and the balance. We wear many hats.
Yeah.
So it's one thing to get your muscles strong and all, but how to utilize it in a safe and functional way. So it's a lot of big picture stuff. We're not just your personal trainer.
Yeah, excellent. I know I've heard a lot about even using your energy appropriately. Conservation of your energy, is that some of the work you would talk about breathing or other issues, like you said, other than just muscle? But
yeah, there's a lot of education that goes into play. People with chronic conditions, COPD, asthma. So to even just ways of awareness of, this is what you do have, and these are ways to help. We can't cure it, but make it work with you instead of against you.
So you have those people who have just after surgery, you're going to help them recover, but then there are people, like you said, the chronic conditions, but you're there to help their life be better to the best that they can do. Yeah,
as best as we can.
That's very worthy work. Thank you. Well, we've spent a lot of time talking about this. I want to thank you again for your work in Franklin County and with your team of therapists. We do have openings at Franklin County Home Health, and folks can call our agency and talk about working at Franklin County Home Health Agency and get to do the wonderful kind of work that Marissa does. You can call our Human Resources Manager, Ann Boudreau, and our phone number is 527-7531. I'd also just like to remind folks that it is fall and we are doing flu clinics at Franklin County Home Health Agency. So we have a schedule listed on our website as well as in the local papers. You can look for that. Most of the clinics will be happening in October, but they will run through the middle of November. Finally, we are offering our Blue Jean Ball fundraiser at the end of October, and we are doing a quilt raffle that you may have seen throughout the community, going around for tickets for that, and tickets to the ball are also still available, and you can find information about that online as well. Our online address is www.fchha.org. And again, I thank you for watching. Thank you again, Marissa, for being here today and talking about physical therapy.
Thanks for having me.
And if you have any questions about what we've talked about today, you can visit our website or call us at 527-7531. Thank you for watching, and be well.